Alaikum everyone. Assalamu alaikum everyone. Today is our first class on anatomy. So before begin our topic, thorax, I want to discuss about the whole anatomy preparation first, because it is very important. Uh, at very first of our preparation, it seems very challenging, in case of anatomy especially, because there are so many cadaveric images, cross-section images. It is very difficult to start the anatomy. It is like a very scary situation will scary situation happens. So first of all, we have to know what to study and how to study anatomy. If we know that, and with right approach, believe me, at very last of our preparation, the anatomy will be very organized comparatively other subject in OSCE exam, emergency OSCE exam. So the thing is, here, first of all, in case of anatomy of MRCS Part B exam, it is highly visual subject, and you have to give more emphasis on identifying the structure. If you don't identify the structure at very first, examiner will not ask you question further, so you will lose mark, and it is very difficult to pass in that station. So first of all, you have to identify the structures, and for identifying the structure, you have to have a clear concept on anatomy topics. Anatomy has a vast syllabus, but here the positive thing is, if you practice the previous exam question repeatedly, you have a idea. You will grow an idea about anatomy exam, and if your approach by practicing, you can grow. It will be very helpful for you to build up a confidence. If we can show confidence in your exam, then examiner will have a positive impression on you, and it will give you a positive feedback in your result. So come to the point. Here the thing is, you have to practice more and more cadaveric image. You have to see more and more cadaveric image. Not only nowadays, examiners are not following the 𝐬𝐸 anatomy book. Previously, directly they gave cadaveric images from 𝐬𝐸 anatomy books, but nowadays they don't follow that. They follow from various web pages. They follow from various cadaveric images from internet, as per my experience. So you have to build up a concept on every topic. For that, you have to practice more and more images from various sites. The most important thing here, you should have a reading partner. Why you should have a reading partner? Because without practicing by how to answer, how to give a proper approach for a answer, in exam you can't give answer confidently. And if you show lack of confidence in your exam, this will create a very negative impression. So you should have a reading partner, and you should have practice more and more with your reading partner. And another important things, you have to give mock exams, where you can enroll, but you have to give mock exam repeatedly, regularly, because without giving mock exam, you can't build up confidence in you, and that's very important. And the thing is, anatomy, many people just think that anatomy is just about memorization. It is a very wrong conception. anatomy is not just memorization. If you don't have any idea about structure, you don't have any understanding about cadaveric images, you can't uh, keep memorization that about that image so long. And in exam hall, uh, there is so many pressure there. Here there you will get nervous. Normally we get nervous in exam. If you don't understand the concept, you will just can't give delivery to your exam. So understanding, yes, here is very important. As a mentor, I want to give the simplifying concept. I want to uh, I want to deliver it to you the complex concept into simplifying way. And most importantly, I will help you by giving tips and tricks for identifying the structures. If you have tips and tricks for identifying the cadaveric images, it will help you in the exam as well as building a concept. So I will try to build a confidence in you for your exam. So let's start our today's session. Okay. Do you have any questions? Please ask. And another things, if our class won't be interactive, then it will not work. Because if you won't ask any question, then and I will just keep you learning or keep reading, it won't be effective. So please ask any questions. There is no such thing like silly question in your preparation time. So don't be hesitate to ask any question to me. Okay.
Shobnam, you are doing very well. So you can continue. You can share
Okay.
your skill.
So come to our today's session, thorax. I'm sharing my screen. Okay. Is it visible? Is my screen is visible? Hello. Hello. Hello.
Yes, yes,
Yes,
it's
visible.
visible.
Okay, okay, thank you. Just let me know.
Yes.
Okay. So before starting, I want to discuss about in very brief with the marking system of the anatomy. There will be three station in anatomy exam, and each station will carry 20 marks. Okay, and here there is no matter of professionalism. But I will suggest you keep professionalism in every stations, because overall they will observe your scoring. They will observe your expression, and it will give an impact on your result in that day. Okay. In thorax, actually, come to our topic, thorax. uh, there are 8 topics, main topics in thorax, but all are not so important. Among the thorax thorax anatomy, mediastinum is most important. It is like as 3-star topic. heart is 3-star topics, lungs is 2-star topics, and the diaphragm and esophagus is 3-star topics. Other topics comes not frequently. Okay, but we have to go through all the topics, and I will emphasize on the recall questions mostly, and I will teach you the tips and tricks. I won't just keep reading. It will be boring there. So I will just go through the main points, and I will show you the key points you have to keep remember. Okay, so our first today we will discuss half of our contents: sternum, thoracic inlet, perineum, and heart. So first topic is sternum. If you have any question, please let me know. Stop me and ask me question. Okay. So our first topic is sternum. Yeah, this is not important. We all know that sternum has 3 parts, main 3 parts: manubrium, body, Gifford process. Okay, I won't go further. The important things here is sternal angle. It is also called sternal angle of Lewis. Here the key points is at the level of second costal cartilage. Okay. At the level of second costal cartilage, this angle begins, and posteriorly, it is between fourth and fifth thoracic vertebra. This is the key points from sternal angle. And the most important question from here: clinical importance of sternal angle. Okay, so there are so many writings here. I won't go with that. Just I want to show you some pictures here. It has we can use mnemonic here: rat plant. Okay, rat plant. What is rat plant? Rat plant, in rat plant, R stands for rib, second costal cartilage. See, second costal cartilage. We all know it. There is no need to discuss these things. Then come to A. A is stands for aorta. Here we have to know. You all know heart is like this, and here ascending aorta, this is, suppose this is sternal angle plane. Okay, so and our ascending aorta ends here, arch of aorta begins and ends here, and aorta begins from this plane. So this phenomenon happen here. Then come to the T. So T is here trachea. Trachea bifurcates here. Okay, we all know that trachea bifurcates here into 2 main bronchus. Then come to P, pulmonary trunk. We all know that here, like here, pulmonary, where as arch of aorta begins, their pulmonary trunk also bifurcate. And then come to left recurrent laryngeal nerve. See this image. See this image. Left recurrent laryngeal nerve. Focus on this point, not right recurrent laryngeal nerve. It is left recurrent laryngeal nerve. Because here, see here, left recurrent laryngeal nerve, circle here, okay? Circle, arch of aorta in this plane, but right recurrent laryngeal nerve, circle here, this is brachiocephalic turn. Behind the, not brachiocephalic, here subclavian, right subclavian artery. Here's right recurrent laryngeal nerve, circle. You have to know this, because more questions are coming from this this concept. Okay, so right recurrent laryngeal nerve, circle here around subclavian artery, right subclavian artery, and left recurrent laryngeal nerve, circle around arch of aorta at second costal cartilage level, equal to sternal angle. Okay, so left recurrent laryngeal nerve and ligamentum arteriosum. Where is ligamentum arteriosum? Just here. See, arch of aorta, just ligamentum arteriorum is here. Okay. Come to the next. A is plant A. A is stand for azygous vein. Azygous vein drains into superior vena cava in this level. See here. Azygous vein drains into superior vena cava in this sternal angle level. Okay. And nerve plexus, which nerve plexus? Cardiac plexus. Come to this image. Here, superficial cardiac plexus and deep cardiac plexus is situated here. And last, plant thoracic duct. Come to this thoracic duct bends here, okay, at this level. So this rat plant, just keep memorize this thing, rat plant. And another thing, the commonest site of sternal fracture, okay, this thing. Now come to two recall questions. Nowadays it is coming. One is, which nerve lie on the right side of trachea in the superior mediastinum? Okay, right side, focus on this point. Which nerve lie on the right side of trachea in the superior mediastinum? And next question, focus on this. Words lie on lateral side of trachea in the... Compare these two questions, superior mediastinum and at the level of neck. Similar question, but when examiner will ask you a question, don't rush to give answer. Okay, try to think 3 to 4 seconds, then give answer. So here, superior mediastinum, the right side relation of trachea. At right side, I want to show you a picture first. Here, see here, this is trachea, okay? This is trachea and this is vagus nerve. Vagus nerve goes downward, then it circles around the subclavian artery and form recurrent laryngeal nerve, okay? But it don't go to the thorax. It just at the root of the neck, it circles around. And this left recurrent laryngeal nerve goes downward and it enters the thorax and circle around the arch of aorta. Then it forms left recurrent laryngeal nerve. So in superior mediastinum, the relation of trachea in if I want to tell, there won't be right recurrent laryngeal nerve, only vagus nerve, okay, and pleura will be present. So right side relation in superior mediastinum, pleura, and right vagus. Be careful here. There won't be right recurrent laryngeal nerve, but left side in superior mediastinum, there will be left recurrent laryngeal nerve, aortic arch, left common carotid artery, and subclavian artery. So I want to give a small pause for a few seconds. Do you understand this concept? Please let me know. Please let me know.
Yes, the slide preparation is quite good. You are at first you are showing the basic anatomical concept, then the recall question is quite good.
Okay, yeah, this is actually a matter of correlation, so I am showing this. So and lateral side of, okay, why you are silent? All of you are silent. Please talk with me. Do you understand this topic?
It's quite understandable. That's why there is no question here.
Okay. Then let's continue. So, and next concept is here, the lateral side of trachea. relation in the neck. So it is easy. And in neck, you will get common carotid arteries, right and left, lobe of thyroid gland, inferior thyroid arteries, and recurrent laryngeal nerve. Okay, just to see this picture. See this picture. Both side you will get thyroid gland. You will get recurrent both right and left recurrent laryngeal nerve. You will get inferior thyroid arteries, right and left, and you will get common carotid arteries in both sides. It is very easy. Okay. So jump to the next topic. It is thoracic inlet. It is also not so high yield topics. So I won't discuss it more. Just from here, you have to go through the thoracic outlet syndrome. Okay, thoracic outlet syndrome. It is refers to a group of disorder that occurs when nerves or blood vessels. Blood vessels here is subclavian artery and subclavian vein, and nerves here is lower trunk of brachial plexus. When they are compressed, injured or irritated in the space between the lower neck and upper chest, so there will be shown some symptom like numbness or weakness in the shoulder, arms, and hands. To be specific, if subclavian artery will be compressed, then post-stenotic dilatation, aneurysm, absence radial pulse, and there will be a positive Adson's test. If subclavian vein compressed, then subclavian vein thrombosis will happen. So, and next, if lower trunk of brachial plexus will be compressed, then pain in inner arm, weakness, wasting of small muscles of hand will happen. What is the treatment? Transaxillary approach is a traditional operative method here. Okay. And this is the image. You are seeing that this lower trunk of brachial plexus, subclavian arteries, subclavian vein, these are, if these are compressed, then this will happen. Thoracic outlet syndrome, compression. What are the cause? This is very important recall question actually. Okay, cause cervical rib, anomalous fibrous band from C7, Scalene hypertrophy, and Pankos tumor. What is Pankos tumor? Pankos tumor is a bronchial carcinoma, and we will get another question from it. Then I will show you the image. And these things. See, origin of subclavian artery. This is very like when examiner will ask you this question promptly, it is difficult to answer. So try to keep concept origin of subclavian artery, right and left. See this picture. In right side, it is this is right subclavian. We know that arch of aorta has 3 bands. Our famous exam BCS. So this BCS, brachiocephalic trunk, C is for common carotid artery, left common carotid artery, and S for left subclavian artery. So this BCS from B, right subclavian artery, is formed, and from BCS, from S, left subclavian artery directly formed. So come to this question, origin of subclavian artery, right side from brachiocephalic trunk and left side from arch of aorta. It directly origin from arch of aorta. But right subclavian artery is not directly from arch of aorta. It is first from brachiocephalic trunk, then right subclavian artery is formed from brachiocephalic trunk. Okay, this image is good for this topic. Another question, which part of brachial plexus crosses the first rib posterior to subclavian artery? Just see this picture. This is first rib, and this is lower trunk of brachial plexus. And posterior, so what will be the answer? Which part of brachial plexus crosses lower trunk of brachial plexus? Okay. this lower trunk of brachial plexus. This is first tip. Okay, so come to next topic, surface anatomy. It is also updated question. Nowadays it is coming. And surface marking of anterior axillary line, mid axillary line, posterior axillary line. Just see the keywords. Anterior axillary line, a vertical line where the lateral is of the pectoralis major muscle. This pectoralis major muscle, lateral is anterior axillary line. Okay. You have to show on, there will be a living person standing in front of you, and examiner will ask you to show the lines from to that person, on that person, okay, in real exam. So anterior axillary line, you just keep a concept about the surface marking. And who will give exam under the College of Edinburgh, it is very important for them to learn the surface anatomy, because the College of Edinburgh, they like very much the surface marking. So come to the point. Anterior axillary line, lateral is of the where lateral is of the pectoralis major. I want to go with posterior axillary line, where it is a vertical line where lateral is of the latissimus dorsi and teres major muscle. These two key points. Latissimus dorsi, here lateral is posterior axillary line will be situated. And between this anterior and posterior, mid axillary line will be situated, where you can say that it is to the midpoint of the axilla. Okay. Then 3-star question, triangle of safety. We should know it because it is very important in our clinical practice also. We have to know the boundary of triangle of safety. Come to this image. You can learn from this image. It is a very good image for triangle of safety. The superiorly or apex, this superiorly or apex is bounded by base of the axilla, okay? Anteriorly by the lateral edge of the pectoralis major, and laterally by the lateral edge of the latissimus dorsi. Here, focus on lateral edge. Lateral edge of pectoralis major, lateral edge of latissimus dorsi, okay? And inferiorly, it is bounded by the line of the fifth intercostal space. This is the triangle of safety. And what is the clinical importance of it? Intercostal catheter placement is the main clinical importance. Here, insert the chest tube insertion. In case of chest tube insertion, you have to insert at fifth intercostal space, anterior to mid axillary line. Okay. Here you have to tell anterior to mid axillary line. There are many study materials where it is written that only mid axillary line. Not. You should tell anterior to mid axillary line, because if you won't insert anterior to mid axillary line, there is risk of injury to long thoracic nerve, and which consequent on winging of scapula. So anterior to mid axillary line. Here you have to insert fifth intercostal space under the fifth rib and at upper border of sixth rib. Okay. To avoid the injury to neurovascular bundle in costal groove. So from this, you have to know these key things. Now come to some recall questions. Why bradycardia after chest tube drain insertion? This is a scatterly recall questions. You have to know, okay? So irritation of vagus nerve is the cause. How does bronchial carcinoma cause hoarseness? Here I'm showing you the pancreas tumor or bronchial carcinoma. This pancreas tumor is compressing the recurrent laryngeal nerve here. This white thing is Pancoast tumor. This is compressing this recurrent laryngeal nerve. See this vagus nerve, and it is circle around here, and recurrent laryngeal nerve is beside the trachea. So this recurrent laryngeal nerve will be compressed. So what will happen? How does bronchial carcinoma cause hoarseness? When there will be compression or invasion of the recurrent laryngeal nerve by the Pancoast tumor, then it will cause hoarseness. And this is from lungs. Actually, we will discuss it in lung topic also. Vertebral level of hilum, just right side it is T5 and left side it is T6. And the high yield topic, mediastinum. Okay, it is very, very, very important from thorax. Very much important. Just see. The sternal angle. This sternal angle, it has more synonym, like it is called imaginary line extending from the sternal angle of Lewis to the lower border of Twyford. It is also called plane of Ladwig. Examiner can ask. It is recall question. Remember, it is recall question. It is a plane of Ladwig or transverse thoracic plane. Okay, plane of Ladwig or transverse thoracic plane. It is important to know. So come to this. This plane divided superior mediastinum and inferior mediastinum mainly. And inferior mediastinum is divided into three parts: anterior, this middle, and this posterior. And for our MRCS exam, most important is posterior mediastinum. And today I want to discuss about posterior mediastinum in detail, because other mediastinum is not so important. Just go through once and try to keep concept, but the posterior mediastinum is most important. Okay, so what is the boundary posterior mediastinum boundary? So come to this. Anteriorly, here, posterior mediastinum. See this image first. This is heart. So here pericardium will be present, this and this side. And posteriorly, vertebra is present. So come to this theory. Anteriorly, pericardium, bifurcation of trachea, pulmonary vessels, bifurcation of trachea here at sternal angle. Okay. Here posterior mediastinum. So bifurcation of trachea will be anteriorly. Anteriorly, it is bounded by pericardium, bifurcation of trachea, pulmonary vessels, and upper surface of diaphragm inferiorly. Okay, upper surface of diaphragm. Now come to posterior boundary. So posteriorly, it is bounded by lower 8 thoracic vertebra, 5 to 12, T5 to T12, and intervening disc. This should be memorized. T5 to T12. T5 to T12. Posteriorly it is bounded. And on each side there will be mediastinal pleura. This is the boundary. It is also frequently asked in exam. Most asked question in exam is what are the contents. So here don't just memorize. Tips is here. Which organ is situated in posterior mediastinum? Just think, it is esophagus. Okay. Which artery is present? Descending thoracic aorta and its branches. Which vein is present? Azygous vein, hemiazygous vein, accessory hemiazygous vein. Which nerve is present? Vagus nerve and greater and lesser splanchnic nerve. Okay. And which lymph node? Thoracic lymph node and lymph nodes. So you just categorize it as which organ, which artery, which vein, which nerve, lymph node. This is tips to memorize it. Another tips is to keep memorize mnemonic dates. Okay. for the contents of posterior mediastinum. There's D stands for descending aorta, artery, astragalus system, vein, thoracic duct, lymph node, and esophagus organ, and sympathetic or splanchnic nerve. Okay, there's, you can remember through this also. And the next recall question is complication of perforated esophagus. There are 4 complications. You will tell 3 first: surgical emphysema, mediastinitis, and sepsis. If examiner will ask to tell further what else, then you can tell hemorrhage. Okay. So this was our most high yield topic from thorax. Any question? Just let me know quickly, please. If we won't talk, then I think I can't give you proper information and class won't be effective. Just tell me, any question?
Problem, it is going well, very well. You are doing very well. Just continue. If we have any confusion, then that's good.
Okay.
It's
Then
quite good. You are showing the results side by side, and you are showing telling how examiner are questioning and
yeah.
how I will be the answer. It's quite good.
Okay. So come to the next topic. It is astragalus vein. It is also important, but not high yield. It is sometimes it is asked. So first of all, we have to know what's the formation of astragalus vein. Come to this image. This subcostal vein and this right ascending lumbar vein. Subcostal vein and right ascending lumbar vein. These 2 veins are forming astragalus vein. Okay. So this is the formation. Which level? Opposite L1, L2 level. So opposite L1, L2 level, right ascending lumbar vein, right subcostal vein. We have to memorize these 2 names. And then examiner can ask what are the tributaries of astragalus vein. So here you can use mnemonics, or just you can keep concept, and you can you can keep concept about it for memorization. First of all, 8 tributaries mainly: right superior intercostal, and I want to tell that second, that 5th and 11th right posterior intercostal, because these 2 are same type: right superior intercostal and 5th and 11th right posterior intercostal. Then hemiazygous, accessory hemiazygous will come. Then mediastinal vein, pericardial, esophageal, and bronchial. These 4 things: mediastinal, pericardial, esophageal, and right bronchial. It should be, you will memorize it, and by seeing this MS, it will help you to memorize. And this is the one of most important cadaveric image, but you have not showed the all structures in it. I will show you what what are the most important. Okay, from here. First of all, I want to teach you tips here. When you will see this at very first, which side you will determine promptly in exam hall, because you will get nervous, and you won't get much time to think. So when you will see this arch of aorta and descending thoracic aorta, all structure will be left-sided. It is left-sided. Here there is no right-sided structure. Okay. And I will show you another image. This 2 images is very important from thorax, posterior mediastinum. This astragalus vein, the tip is here, is all thing will be right-sided, because astragalus vein is right-sided. Just you will observe where it is astragalus vein, or whether it is aorta or descending aorta. Okay. If descending aorta or aorta, it will be left-sided. If azagus vein, it will be right-sided. This is the first thing you have to observe. Then come to the structures. So here, three is arch of aorta. Don't tell just aorta. Don't tell this, because if you will tell just aorta, then examiner will ask you again which part, or he will ask to be specific. It will give a negative impression. So try to answer completely. It is arch of aorta, and 32 it is descending aorta. Okay, these two part. Then come to this lung root. We will discuss it in detail when we will discuss the lung topic. But here I will show you tips. Always remember, in lung root, you will get the artery. You will get the artery superiorly, you will get the vein anteriorly, and you will get bronchus posteriorly. So as it is vertebral, it is posterior side, it is anterior side, and it is superior side. So what will be here? 16. What is 16? 16 is left pulmonary artery. Okay. See, it is superiorly. Vein you will get anteriorly. 21, and this structure 21 will be left superior pulmonary vein, and this is left inferior pulmonary vein. Okay, and 15 is bronchus. Which bronchus? Left principal bronchus. So we have completed roots, we have completed aorta. Now come to this 24. Here is ligamentum arteriosum. It is very favorite question to the examiner. What is 24? 24 is ligamentum arteriosum. Okay, then come to the nerve. 22, this nerve, it is anteriorly. So what will be it? It will be vagus nerve. See, it will be vagus nerve, because left-sided vagus nerve, we have already studied that left-sided vagus nerve circle here around arch of aorta. So 22 will be vagus nerve, and here, what is 17? 17 is left recurrent laryngeal nerve. See, this will be like a circle here. 22 is vagus, and 17 is left recurrent laryngeal nerve. What is 33? 33 is here, thoracic duct. Okay, you have to keep remember this. Now come to these two structure. This blackish structure, always think blackish structure can be vein mostly, and reddish or reddish shiny structure will be artery. Okay, this 13, it is a blackish structure, so it will be vein. Which vein? Left internal thoracic vein. 13 is left internal thoracic vein, and 12 is internal thoracic artery. Which side? Left sided. All here is left sided. So you have to mention the side must. Don't miss it. Now come to these two structure. 29 is 29 here is subclavian vein, and this is subclavian artery. Okay, come to this. It is important. What is 31? 31 is sympathetic trunk and ganglia. Okay, they marked it here. It is ganglia. So you have to tell whole thing. You have to tell sympathetic trunk and ganglia. Okay, sympathetic trunk and ganglia. 31, ganglion. And what is 8? 8 here is left side. You will get mostly hemiazygous vein, because right side we will get azygous vein, but left side we will, in left side we will get hemiazygous vein. 8 is hemiazygous vein. Okay, and there are more structures. Just go through. It's not important for you for the exam. I have already discussed the most coming top structures in exam. Okay, come to this image. It is another posterior mediastinal image. Just here, what is 10? 10 is phrenic nerve. You have to keep memorize it. And here we can see that sympathetic 11 is sympathetic chain. This is 11 is sympathetic chain. Okay, 12 is ganglia. See, here is a bulge point. This is ganglia, and this is chain-like structure. It is sympathetic chain. And 10 is phrenic nerve, and 9 here is esophagus. It is important. 9 here is esophagus, and examiner can ask from many questions from esophagus. Esophagus is also high yield topics from thorax. Okay. Now come to this cadaveric image. First of all, we will observe what? Azagus vein. So it is right-sided. Then come to this lung root. This is anterior side, this is posterior side, and this is superior side. Okay. So here, sorry. Okay. Here, what will be 2? I have told you already the tips. You will get artery superiorly or at middle. Superiorly or at middle. You will get vein anteriorly, and you will get bronchus
Excuse
posteriorly.
me.
Okay.
Okay, now the page changed. We were stuck on the previous page. Thank you.
Okay. Ask. Hello. Do you want to ask a question? Excuse me.
No, just we couldn't see the slide. We were on the previous slide yet.
This slide?
No, when you were explaining the right side, we were still on the previous slide.
Okay. Previously. Okay. Now it is okay?
Yeah, nah.
Okay. So it is right-sided. Azagus vein, we can see here azagus vein. Now come to the root of lungs. Okay. This the tip is artery will be superiorly or middle, vein will be anteriorly, and bronchus will be posteriorly. This is posterior side. So here focus on this structure 2. It will be artery. Which artery? Branch of right pulmonary artery to superior lobe. Okay, this is not so important. So, and 15. What is 15? 15 superiorly and middle, it is also artery. 15 is right pulmonary artery. This structure 14. See, posteriorly it is bronchus. 14, right principal bronchus. And 18 anteriorly, this 18 will be vein anteriorly, right superior pulmonary vein. So this is the tips for root of lungs. And now come to the nerve. This nerve, it is very important. Phrenic nerve and vagus nerve, this is very important for MRCS exam. The examiner frequently asks these two identifying structure. They ask where is phrenic nerve and where is vagus nerve. So phrenic nerve is very important. Here 13 is phrenic nerve. Okay, we can see that azagus vein is draining into superior vena cava. So 24 here is superior vena cava. Then come to this structure. It is shiny reddish structure. So it will be artery. Which artery? It is internal thoracic artery, right-sided, right? Internal thoracic artery. We will, without thinking, we can tell that it is right-sided. All structure will be right-sided. Okay? If we observe this azagus vein at very first. So right-sided, right internal thoracic artery. Then come to this side. It is also very important for MRCS exam. What is this? Chain-like structure. This is sympathetic chain. 27, sympathetic chain with ganglia. This bulging point, these are ganglia. So 27 is sympathetic trunk and ganglion. What is this structure? 3. It is also important. It is branches of sympathetic trunk to greater splanchnic nerve. Okay, 3. These are the branches of sympathetic trunk to greater splanchnic nerve. Then come to, we have already covered most important structure. Then come to here, superior intercostal vein. We have already read here the branch, right superior intercostal vein, branch from azygus. So here, azygus superior intercostal vein. Okay. These are the most important. And another important 19 structure, right vagus nerve. See here, right vagus nerve. Right vagus nerve. Okay. These are the important structure from this image. Other structure you just go through once for concept. Those are not asked in exam actually. Here I want to show you another image. Is it seen? Okay. I think it is seen.
Yes.
Okay.
Clear.
Okay. Here, focus on this yellow structure. This is sympathetic trunk. And here, 3 intercostal vein is marked. Intercostal vein C. Bluish is always marked for vein, intercostal vein, artery for reddish structure, and nerve for yellowish structure. Okay. And here, interesting thing is thoracic duct. Here it is seen. It is thoracic duct. It is esophagus. Descending aorta. It is azygus vein. Here, descending aorta and azygus vein both are seen. Thoracic duct is also seen. Okay. So this is a aberrant picture from these 2 traditional picture. Just be careful of it also. So there is no need for other structure. Oh, sorry. Greater splanchnic nerve is also important. See, this is greater splanchnic. So let's start another high-yield topic, heart. Nowadays, it is very much favorite topics for examiner. Especially nowadays, blood supply of heart is are asked, which was not famous previously, but nowadays it is asked. So first of all, from heart, here see this picture. I will show you some tips from very first, so that I can use it for further discussion. Here, heart is like it is lying. Okay, this is, we will start from right atrium. This is right atrium with, this is appendages. It is called appendages, a extended part of right atrium. So right atrium and right atrium with appendages. This is pot-like structure. It is right ventricle. See, this is right atrium. This is right ventricle. It is seems like pot, cooking pot. Okay, right ventricle, and beside a cooking pot, there will be another part. It is it is left ventricle, and above left ventricle you will get left atrium and auricle. Okay. Especially some image you can see left atrium. You can in some image you only can see left auricle. You have to observe carefully. Okay, come to this point. These 3 vessel organization. Be careful with this. This 3 vessel organization, I use a mnemonic. It is SAP. Okay. S for superior vena cava, A for aorta, ascending aorta, arch of aorta, and P for pulmonary trunk. Always you have to maintain this organization, SAP. And I have already told this is pot-like structure. If you will see an image, you just try to imagine where is the pot, and this pot, the top portion of the pot will be pulmonary trunk. Okay, just a funny discussion. So pulmonary trunk, arch of aorta, and yeah, this SAP mnemonics for these great vessels. And you all know this branch mnemonic BCS. B for brachiocephalic trunk, C for left common carotid artery, S for left subclavian artery. And brachiocephalic trunk will give branch right-sided common carotid and right-sided subclavian and right-sided common carotid. Subclavian common carotid. Okay. And this is inferior vena cava, and we have to know the artery supply. Okay, I will show you in easy way further. First of all, come to this. So just keep in mind this image. So what will be right border? Just look at this. Right border is formed mainly right atrium, only right atrium. Okay. Left border is left ventricle, mainly left ventricle. Just keep remember it, mainly left ventricle, right atrium. And this inferior border, it is right ventricle, the pot, cooking pot, okay, or water bottle, whatever you can say. So this is right ventricle with a small part of left ventricle apex, at apex. Okay, just keep remember this image, this two images. And superior border, right and left atria, these two atria and their auricles. Okay, and great vessels. These are the border you have to know. Come to this image. It is also important for exam. See, now I will use the tips I have already told you. This is a P, and this pot, water pot or cooking pot, whatever you can tell. This pot, the top of pot is pulmonary trunk. So SAP. This is, if it is S, then superior vena cava, and below superior vena cava it is right atrium. 18 is right atrium, and the extended part of atrium is appendages or auricle. So it's also called auricle. So right atrial auricle. 5 is auricle of right atrium. 18 is right atrium. 25 is superior vena cava. Now come to this cooking pot. It is right ventricle. It is right atrium. It is right ventricle. It is pulmonary trunk. The top of cooking pot. Beside cooking pot, you will get left ventricle. Okay. So, and between these two vessels, you will get SAP at aorta. Aorta, from here, it left ventricle. Okay. Aorta. And this blood supply, we will discuss it in very easy way further. Just here I want to tell 19 is from right coronary artery. It is right coronary artery. 19, there are two branch of arch of aorta. Remember, it is arch of it is ascending aorta, not arch of aorta. Ascending aorta has two branch, right coronary artery, left coronary artery. And arch of aorta has three branches, BCS. And so it is right coronary artery. And it is marginal, 12 is marginal branch of right coronary artery. Okay. And 24 is not important. It is a small cardiac vein. It is not asked actually. This, what is this for? It is this left atrium, so left ventricle, and this is left atrium not. It is auricle. Four. It is auricle, tiny structure, auricle of left atrium. Okay. And other structure just go through. The interior of the heart, it is not important. Just keep reading once. I want to teach you a tips. Sinus venorum. Okay, this sinus posterior smooth part, and here in right atrium posterior smooth part, sinus venerum, and right ventricle inflowing raft part, or sorry, here this one and this one, these two are vessel. Okay, vessel is smooth, and this ventricle proper and atrium proper, these are rough. Vessel is smooth and these are rough. It is not asked, and don't worry. Come to this auscultation, heart valves and auscultation. Just I want to show you this image. This keep remember A P T M. Okay, it is very important for our clinical examination also in cardiovascular system. So try to keep remember this. It's aortic, pulmonary valve, aortic valve, tricuspid valve, and mitral valve. These two both are situated in second intercostal space. Both are situated in sternales. Okay, and on aortic, it is right side sternales, and pulmonary, it is left sided sternales. And tricuspid, it is also at sternales, but which side? It is fourth intercostal space. Okay, it is fourth intercostal space. Only mitral valve is deviated in left fifth intercostal space medial to mid clavicular line. These three are at sternales. Only this is situated at right side, and this three is left side. Okay, just keep in mind this image. It is in second intercostal. It is also in second intercostal. It is right side. It is left side, and only mitral valve is deviated at fifth intercostal space, left side, medial to mid clavicular line. Okay, so just keep remember this image. And sometimes examiner asks how many cuffs in pulmonary valve or aortic valve or tricuspid valve. Just sorry, just keep remember only mitral valve has 2 cuffs, and other 3 valve has 3 cuffs. Okay. So come to this. There are some scattered recall question. What is the function of chorda tendineae? It prevents collapse of the valve during ventricular contraction. Branches of ascending aorta, right and left coronary, and vertebral level of pulmonary trunk. It is 3, 4, 5. Okay. Now come to these two images. Okay. From here, see, we will try to find out the pot-like structure. This is pot-like structure, kicking pot. So it is right ventricle, and this is pulmonary trunk. Okay, and if it is P, then beside it, it will be A and S. Here, S is not seen. So 13 is, yes, S is seen. 13 is S. A is A, and P is here. So 13 is superior vena cava, 4 is here, here 3 is ascending aorta, and 9 is pulmonary tongue. So these are 3 blood vessels. Okay, beside these 3, and this 10 is right atrium with 4 auricle of right atrium. Now come to this area. Here 1. What is 1? Anterior cuffs of tricuspid valve. We know that at right ventricle, here tricuspid valve is present here. So 1 is anterior cuffs of tricuspid valve. 5 is chorda tendineae, like this style structure. 5 is here chorda tendineae. What is 8? 2. Both are papillary muscle. 2 is anterior papillary muscle, and 8 is posterior papillary muscle. This is anterior papillary muscle, This is posterior papillary muscle. Okay, and 11 is not important. It is septomarginal trabeculation. Just go through once. These are the important structure from here. So here 9 pulmonary trunk. What is 7? 7 infundibulum of right ventricle. What is infundibulum? It is the starting part of pulmonary trunk. 7. Okay, infundibulum of right ventricle. Here 7 is infundibulum of right ventricle, or it is also called conus arteriosus. 7. Come to this image. It is also important. Here, pot-like structure is this, right? So it will be pulmonary trunk. Beside this, we will get A. Here, S is not seen. So this is pulmonary trunk and this is aorta. A is ascending aorta and this E is here pulmonary trunk. This pot-like structure, if it is right ventricle, then what is B? This extended part of right atrium, it is called auricle of right atrium, B. This C here is pectinate muscle, D here is chorda tendineae, and H here is papillary muscle. G here is anterior interventricular branch of left coronary artery. This, it will be more clear when I will learn you the artery supply of heart. Don't worry. So come to blood supply of heart. First, I want to show you the image. I love it to show you image first. Okay. This, sorry, please for 2 seconds. Okay, come to this image. This is aorta, okay, ascending aorta. It has 2 branch, right coronary artery and left coronary artery. See here, right coronary artery will go some distance and then it will give branch. Okay, but left coronary artery will give branch at very first. One branch is circumflex branch of left coronary artery and one will be anterior interventricular branch of left coronary artery. Interventricular, this pot-like structure is right ventricle and beside this it is left ventricle. So between these 2 ventricle you will give interventricular branch of left coronary artery, which it is anterior surface or anterior view. So you will get anterior interventricular branch of left coronary artery. And remember, posterior interventricular artery is a branch of right coronary artery. So it is important. That was not important. Anterior interventricular branch of left coronary artery and circumflex branch of left coronary artery. It will branch at very first. Okay, this is important to keep remember. Now come to right coronary artery. It will go a few distance, then it will give branch. First branch along margin. What is its name? It is right marginal branch of right coronary artery, and then it will circle around and go posteriorly and give posterior interventricular branch. Okay, that is not important. Now come to this flow chart. Just keep concept so that if examiner will ask you question, you can give answer. Aorta. Okay, aorta will give right. I have already show you on image right coronary artery and left coronary artery. Right coronary artery, right marginal, along margin, right marginal branch and posterior interventricular branch. Okay, and left coronary artery, this circumflex and anterior interventricular branch. Okay, and this another 2 branch, SA nodal and AV nodal. 60% people, SA nodal is come from right coronary artery, and in 40% people it comes from right coronary artery, AV nodal artery. This is not so important. If examiner will ask question, you have to answer according to type of question. So again, I want to recapitulate. This is arch of aorta. Sorry. This is arch of aorta. It is giving two branches, right coronary artery and left coronary artery. Right coronary systems and giving branches along margin, which is called right marginal branch of right coronary artery, and also posterior interventricular branch. And left coronary artery, at very first it will give branch, circumflex branch and anterior interventricular branch. Okay, this is very important. You have to use this concept in many images. See here, this image I have added for practice. This is, as per I know, it is exam images. You have to use the tips and concept. See here, SAP. Okay. Sorry. This SAP, superior vena cava, aorta. Sorry, arch of aorta. This is arch of aorta, ascending aorta, and pulmonary trunk, the spot-like structure. So it is right ventricle. Beside right ventricle, you will get left ventricle, and it is right atrial appendices. Okay. This you have to go through. Most commonly, this anterior view is most high yield for exam. Okay. But you have to practice different angle images for concept. See here, it is like this is a little bit different. This is atrium, right atrial appendices. It is superior vena cava, it is inferior vena cava. Right ventricle, aorta, pulmonary veins, and right atrium. This side is right atrium. Okay. This is also you can practice by using the tips. Okay. Most important, anterior view. This view. This view. It is most important. This view. This is most important view. And before exam, like a few days before exam, don't go through the new topics or images. Just keep revision the previous exam topics and the images you all have already go through. The commonly coming topics and images. See here, this is here the structure A is ascending aorta, this C is pulmonary trunk, and this B is descending aorta. Okay, this is not so important, just for concept. You can go through. And this image, it is also a beautiful image. Here I want to show you this bottle or cooking pot like structure. Pulmonary artery, right ventricle. Beside right ventricle, you will get left ventricle, left atrium, and right atrial appendages, right atrium. This is aorta. If it is P, it will be A. Okay, A. And this BCS, the branch of arch of aorta. Brachiocephalic artery or trunk, left common carotid artery, and left subclavian artery. Okay, this is pulmonary pulmonary artery, and this here I have added this picture for this mainly ductus arteriosus. It is very favorite for to our examiner. Okay, ductus arteriosus, pulmonary artery, and ductus arteriosus, the connection between these two structure. This is ductus arteriosus. And I have added this image from a very renowned website from where the images frequently is coming in exam. Okay, so it is important image. So we have completed our today's contents from thorax. If you have any question, please feel free to ask. We will start from lungs in our next class. So ask me question, please. Is there any question? Am I able to make you understand?
Yes, doctor.
Okay, thank you. If you have any question, please let me know, or I will finish for today.
Doctor, are you sharing the PDF with us?
You have to contact with Genesis Outlier group for that. They will tell you detail.
Okay.
Okay, thank you. Okay, if you have no question, then I will finish for today.
Thank you so much. It was really helpful and everything was so clear.
Thank you so much. It means
Thank
a lot
you,
to
Dr.
me.
Shabnam.
Thank you.
That's awesome
Okay.
session it was.
Okay. So let's hope for the best and see you in our next class. Okay, I will show you more images and I will teach you the tips and tricks for identifying structures.
Dr. Shabnam, we hope we will find you every Tuesday at the
Yes,
same time.
inshallah,
You'll be
inshallah. Every
with new
Tuesday,
topics.
yeah.
And everyone will be master of anatomy like you from this course. From this
More than
anatomy
me,
course.
inshallah.
Okay, Dr. Shabnam, thank you so much.
Okay. Assalamu alaikum.
Thank you very much. Very nice.
Okay.